Hi, welcome to Health Talk with Dr. Akram. I am Akram. In this program, we'll be talking about all kinds of different health issues with different experts in the field. But today, we'll be talking about fall and hip fracture. So sit back, relax, enjoy your time with us. Anyone can have fall, but older people are more vulnerable and likely to fall, especially if they have a long-term health condition. Falls are common, but often overlooked cause of injury. Around 1 in 3 adults over 65 who live at home will have at least one fall a year, and about half of these will have more frequent falls. Most falls do not result in serious injury, but there is always a risk that fall could lead to a broken bone, such as hip fractures. Hip fractures are associated with significant morbidity and mortality and financial burden, and also it can cause the person to lose confidence, become withdrawn, and feel as if they have lost their independence. Hip fractures are cracks or breaks in the top of the thigh bone, is called femur, close to the hip joint. They are usually caused by a fall or an injury to the side of the hip, but may occasionally be caused by health conditions such as cancer that weakens the hip bone. In usual care report, 1-year mortality after sustaining a hip fracture has been estimated to be 14 to 58%. The annual cost of the care of these patients is estimated around £2 billion in the UK and is ever growing. An increased early and late mortality rate is also recognized in these injuries, together with significant adversities for the patient. The aim of this program is to make awareness among our viewers about fall in elderly people and the consequences behind it, how we can prevent fall, how we can make a safe environment for our loved ones, and in case if they happen to fall, how we can safely look after them. Please welcome our special guest on the show, Mr. Mohamed. Ahmed is a consultant orthopedic surgeon in Essex, and Dr. Pratham Surya, who is an orthopedic surgeon from Midlands, but he is joining from Ireland, Dublin. He's doing some important work there. Okay. Mohamed, it's nice to have you here in the studio.
Thanks, Akram. Thanks for having me tonight with you.
Pratham, how are you doing? Pratham Surya.
Hi, Akram. Thank you very much for inviting me to this program. I watched your few videos, and I think you're doing a very good job for your viewers regarding the basic health issues.
Excellent, guy. Excellent. Okay. So far we have, okay, let's talk about Mohamed. What do you do? What is the job generally?
I'm an orthopedic surgeon, as you mentioned, working in Essex. I had my specialty in general orthopedics and still doing that as part of my daily activity. I have subspecialty in spine surgery, but during local on-calls, I cover all orthopedic type of injuries when we get them, from simple fractures to complicated ones, and that's how we deal with it.
Amazing. That's very good. Pratham, what are you doing in Dublin? Are you in a holiday?
Currently, even after we met after fellowship in Bournemouth in knee surgery, I got a consultant post in Dublin in a private firm, which predominantly concentrates on stem cells and hip and knee problems. So that's what I'm currently working in Dublin as.
That's quite interesting what you do there. Stem cells, this is quite new to us, but I think we will be talking about it at some point in our show. But anyway, today we are here to talk about falls and hip fractures. This is very important. Anyway, this is a live program, so if you have any questions, you can call us on 0203 515 5788. If you have any further questions, you can always write to us on our Facebook link or healthtalk@intv.co.uk. And let's go back. Pratham, how common are these falls?
Yeah, Akram, I think when you mentioned in your introductory, of the falls, you quite well covered. Falls happen to almost everybody, on the day-to-day basis. But the thing is, in the elderly population, this can be a serious issue. And from the statistics, we know that, any people who are more than 65 years, at least 1 in 3 will experience a fall in their lifetime. And out of these, and half of them, they go to have falls multiple times in a year. So this is quite an important issue to address. As you have said, it can have consequences which may not be serious always, but there are other consequences where you can break bone, and also like your repeated falls, it will bring the confidence of a person itself down, and then they'll be limited just indoors. They can't socialize with other people. These are all the consequences you can have with the fall. So it's quite important to address it and prevent the fall.
Exactly. This is the problem. Is even though it's quite serious, but it's overlooked, isn't it? People don't think it's a serious problem. There are a lot of elderly people living with us, especially with the advancement of the medicine. People tend to live long, and they have quite good quality of life. So, Mohamed, what's the main reason for this falls? What do you think?
Well, there are many reasons for the falls. I mean, aging is becoming a big issue. As you said, you mentioned that also the advance in medicine has caused that we are living more longer. But the main problems is the balance, which is a big problem with the older people, plus the weakness of the muscle, which might be contributing, both of them going at the same time. People have poor vision or reduced eyesight. That can be also another cause. And the main problem is also the long-lasting health conditions. Yes, from heart disease to dementia to low blood pressure. All this can cause kind of a dizziness. People might get the falls, and out of it a lot can happen.
Exactly. Pratham, what should someone do if they have a fall?
Yeah, Akram, whenever somebody has fall, it depends on the situation. They may be alone, or they may be with someone. The basic thing to do whenever you have a fall is not panic, stay calm. And if at all you have anybody around you, please call for help. And it depends, after you have a fall, if it is not quite significant and you're feeling not much of pain, try to stand up gently with, either using support with your arms, or if there are any chairs or anything, use the support to stand. But if it is very painful, you please try to call for help, and don't try to do anything which will lead to more damage than what you are. So if at all you're with somebody, or you are caring for an elderly person, whenever you have a fall, make sure the environment is safe, position in, and if you're trying to cope, and then they're arriving more than an hour, you try to change the place of the you try to change the person so that they don't get pressure sores. And if it is quite a serious fall, please call 999 as an emergency, so somebody will come and attend. And in the meantime, make sure the person is stable.
That's very interesting. I think even though the falls are very common, but if they have broken bone, they have to be aware, isn't it? That's the main thing. I think that's the main aim of our talk as well today. But anyway, we're going to discuss more about this.
And especially, when you break your hip bone, you won't be able to stand, which then, if you're alone, that can be quite a serious consequence before somebody reaches out to you.
Exactly. Mohamed, let's go through a bit of underlying conditions for behind these falls, because I think this is really important. People can, people who has these conditions, they'll be aware of these things, such as like urinary tract infections, things like that.
Exactly. I mean, we go through our life, we get some kind of disease from time to time being treated. Some people get with aging, their immunity might be a little bit reduced compared to young people, especially elderly. They are more prone for different kind of type of infection, like a chest infection. If you get a pneumonia affecting you, you might be weak. That might be the other one of the causes of the fall. If you get a kind of a urinary tract infection or any kind of an infection in the body, that's all can be giving you the general weakness and can lead to this type of falls.
That's true, isn't it? I mean, when I was doing some research, and I'm not an expert in this field, but anyway, I had to study a lot for this program. So under this program, I have found out what else there are causes. UTI, urinary tract infection, dehydration, anemia, pneumonia, as you said, heart problems, atrial fibrillation, and stroke. Yes, stroke is another condition.
And that's one of the major serious ones.
That is a serious condition, because they would have had the stroke and had the fall afterwards, isn't it?
Yeah. And you might lose conscious by the time you regain it. You have to check, as my colleague said just at the moment, you have to make sure you're safe before you start moving, check if you are hurt or not, and call for help.
Exactly. Yeah. Let's talk a little bit about stroke, even though we didn't prepare much about it, but I have done a special program on stroke, and you can go back always and see in our YouTube link, Health Talk with Dr. Akram. But anyway, we'll update a little bit. But if they have a stroke and had a fall, so they might have if they had a fracture, but the evident thing will be the fracture, isn't it?
The fracture will be evident, but if you have a stroke and you've lost part of your feelings and
exactly,
everything on that side, you might not be aware that you have broken any part of your body.
Oh, right.
And especially the hip, and you try to start moving and you find that you can't stand on your leg, you're collapsing again, falling again. So that can be one of the issues. But a stroke might lead at the beginning to weakness, and you will feel that the whole part of your body is weak. So the question is, do you have an injury or is it a stroke? So we should not eliminate any one of them.
That's amazing. That's amazing. Pratham, let's talk about underlying chronic conditions.
Yeah. See, Akram, any conditions that, alter your blood pressure, especially with the elderly population, you have something like a postural hypertension, which means, when you suddenly, from a sitting position, you stand up, your blood pressure drops. That can cause dizziness and lead to fall. And also, another thing which I will add on, which you have covered most of that, is the people who are having, taking medication. Some of the medications, like blood pressure tablets, diabetes tablets, and if they're on sedatives, the sleep tablets, they all can cause poor coordination and make you fall. So it's important, to check your medication regularly with your GP and make sure you're in the right dose to prevent this. And blood conditions you have already talked, anemia, and also it's important you hydrate yourself. Electrolyte imbalances can cause a problem. And other issues are like gait imbalances. So as my colleague already mentioned, when you have a weakness in your muscles or your joints are not functioning, this leads to, painful gait, which can lead to fall. And vision is another important factor. So, when you can't see, you may, trip and fall. This is one of the factors. And also your problems associated with your foot. So any foot condition can cause you imbalance. So you need to regularly check with your podiatrist and orthotics, make sure you are having the correct footwears.
That's amazing.
And other than that, you already covered the underlying heart conditions, which can again cause a problem with the balance.
Yeah, especially with the vision. Vision goes slowly. People don't realize it until they really lost a huge amount of vision.
Yeah, and that's also combined with the other thing that most of the falls happen during the night when people getting out of bed going to the toilets. One of the other reasons also, the low lights at home. Is there anything on the way? So lighting of the room is a very important thing. We are trying, people wake up during the night rushing to the toilet. That might cause the fall.
They don't want to wake up their partner as well, so
exactly.
They don't switch on the lights.
Exactly. And then you have also what type of slippers do you have on? Is it well fitting? Is it sliding? Is there any wetness in the bathroom while you're going in? So there is a lot of things we have to consider, and we have to be careful, especially when we're waking up during the nights.
Actually, they are doing some kind of the lower floor lighting, which is a sensor oriented, especially for elderly people's home, if they request.
Exactly.
So when they come out of the bed, this low level light lit up, so they could still see the main light, even if it won't come out, but they could still see the floor where they're walking.
Exactly. Yeah.
That's a good point, isn't it? And there is another thing, is the vitamin D deficiency is also in one of the major issues as well, isn't it, for falls, because the bone,
the strength of the bone and how strong is the bone. People are with aging are more prone to multivitamin deficiency that might weaken different parts of the body, but the bone is a most important element, and the weakness or the deficiency of vitamin D play a major role in this case.
In this condition, okay. Hi, welcome back to Iron Health Talk with Dr. Akram. Today we are talking about fall and hip fractures. This is a very common condition. This happens especially in our homes. There are a lot of elderly people living with us in these days, and this is an important program. So we so far have addressed we concentrated on the conditions for fall and the conditions behind it, like health conditions and vitamin D deficiency and orthostatic hypotension. These are the things, like especially when people stand up and the blood pools down to their feet, especially this happens in elderly people. But anyway, we're going to look at a video. This video is kind of provided by Kaiser Permanente Thrive through YouTube, and this explains a lot about our program. This is about hip fracture and what kind of mortality and what happens to them afterwards.
Ann Taggart is 92. She still gets around fairly well, but not like she used to before her second hip fracture.
I've had two, one about 7 years ago, my right hip, and that was in my front steps. I turned around to say hello to a neighbor who yelled across the street, and I slipped and fell on the steps.
Taggart broke her other hip last year when she fell in her driveway. After that, she started using a walker.
I don't go up any steps that I can't hold onto a rail very solidly.
Taggart is one of nearly 10,000 women in the landmark study of osteoporotic fractures. The study has followed these women for more than 25 years, and during that time, more than 1,100 of them have broken a hip.
Close to 50% of women will suffer an osteoporotic fracture in their lifetime, and many of those are hip fractures, which are the most debilitating type of fracture.
LeBlanc is the lead author of a new paper that finds for women like Taggart, who are 80 or older but still exceptionally healthy, a hip fracture increases the risk of dying within a year by nearly 3 times.
You can't move right after a hip fracture while you're healing. It takes some time to get back up, and anytime you're immobile, you're more at risk for infections, you're more at risk for blood clotting, your nutrition's going to go down because you're not feeling well, and that puts the body in a weaker spot to be able to fight infections or fight any sort of illness that might come on.
The risk of death is actually greatest within the first 3 months after a fracture, when women are recovering from surgery.
I think it's a wake-up call that hip fractures are dangerous and that we need to try and prevent them, and that we need to take really good care of women afterwards.
Taggart takes an osteoporosis medication and a calcium supplement to strengthen her bones. Her family has moved obstacles out of her way, so she's less likely to fall. The cereal boxes are now on the counter instead of in a high cupboard. Most importantly, Taggart moves slowly because she doesn't want to break another bone.
Both times I had a hip fracture, I kind of made movements that were sudden. Now I don't do that. I try to be very cautious.
I'm Mary Sawyers reporting.
Thanks again, Kaiser Permanente Thrive for YouTube video. It's an amazing video. It basically explains what we're talking about here. And in our show anyway, Dr. Pratham Surya joined from Dublin, and Mohamed Ahmed, he's with us in the studio. He's a consultant in Essex, he's orthopedic consultant. Okay, Pratham, fall and hip fracture, how common and what happens here? Why are we worrying about it here?
Yeah, Akram, hip fracture is one of the commonest fracture which we see in United Kingdom. From the statistics point of view, like in 2020, we may be seeing up to 100,000 hip fractures a year. This is quite significant, not just for the patients, and also for the economic perspective for the NHS. So, and more than that, the mortality associated with the hip fracture. So, about 10% won't make it in a matter of 1 month, and about 30% may, die at an 1 year end. So that's quite serious issue we need to take care of. So, and another thing is that hip is one of the main weight-bearing joint in orthopedics. So this leads to quite a lot of morbidity and issues with the walk, and that's the reason this needs to be identified and treated correctly, so you can have a better life once it's fixed. So hip fracture in generally, which means we talk about neck of femur. So hip is a ball and socket joint. So when your ball is connected to the femur, which is thigh bone, the area is called the neck. And this is the most common area in elderly population where you break it.
Thank you very much, Pratham. Yeah, that's so. As you said, it's about really high mortality. Even though you fix the fracture, and even though if we had the surgery to fix it, 10% mortality in 1 month, and 30% mortality in 1 year. So if there are 100 people, 30 people will die in 1 year. That's a huge amount, isn't it?
It is.
Okay, when to call help?
Well, as we mentioned earlier, if you had a fall, you have to be calm, check if you are able to mobilize yourself or not. If you feel that you are in pain, you are not mobilizing, you have to call for help. If some people around you living with you in the home, just try to shout. If you cannot, bang on the wall or on the floor. If you're living alone and you're having difficulty, one of the things, try if you can crawl a little bit to reach a phone to dial 999 so you can get help. Other things which we might recommend, if you have a mobile phone, keep it with you all the time. If you had a fall or something you need help, it will be available to you.
In your pocket.
Yeah, exactly, in the pocket.
That's a very good point, isn't it? Pratham, let's summarize quickly. What happens in A&E when they reach? So they are they have got the ambulance
A&E now. When they have a hip fracture, you're taken to A&E. The main thing in A&E is that they will make sure you are stabilized, so you're breathing well, your airway is maintained, and your blood pressures are normal. And once they identify you have a hip fracture, main thing they would do is refer to an orthopedic department. And most of the A&E will have a fast track to orthopedic department, which means the orthopedic team will come and see them within 4 hours. And in the A&E, basically the management is keep you well hydrated and take care of your pain. And most of the A&Es now, I know they do a nerve block, which is called a fascial block, which reduces the pain significantly so that they don't have to take a stronger pain medication. And once you're stabilized and you're seen by the orthopedic doctor, you're then shifted into an orthopedic ward.
That's very good a way of telling it, and you make our viewers comfortable and what they expect in A&E. I think you summarize it in a really nice way. Thank you very much, Pratham, for that. Okay, let's talk a little bit about surgery. Now they reach the ward, they pass through the A&E, the anesthetist had gone, and he said, fine, he can have an anesthetics. And what do you guys do? Or you could even show in our Iron Man. What do you fix?
Exactly. One thing I want to
pull it closer,
I want to reassure our audience that whenever you come to the hospital, it's not just the broken bone or the hip fracture that we focus on. We look at the whole picture from the fall. What's the cause of the fall? Is there any other things that might have led to that needs to be addressed? So part of our, in all the units in the country here, it's a combination between an orthopedic and a medical department. They have a combined unit where they look at the patient in general, make sure the patient is safe, and even taking you to theater to fix your fracture. We have to make sure that you are stable, you can survive the procedure, and that's the most important thing for us. Procedure-wise, we have a broken bone that needs to be fixed. Depending on what type of fracture and what activity the patient have, what's the expectation according to that, and how much the patient is fit for surgery, that's all plays a role in our general decision on what we can do. There is different ways of dealing with hip fractures, from just fixing it with simple screws. It can be screws with plates, or we can do a kind of what we call change of the hip, changing of the whole hip process. Instead of having a total hip replacement, you get a hip replacement, where the whole idea is we want to get the patient back again, standing on his feet and walking as soon as possible.
That's amazing summary. I think that's very good what he said. But anyway, on this Monday we were working in orthopedic department, and we had 3 patients. They were almost centurions, and they all 3 were waiting a letter from Queen for their 100th birthday. And one patient, his birthday is in January. He's going to be 100, and the other one was 98, and the other one was 97. And of course we had another child who was about 5 years old. So we do operate on lots of elderly people, so that's not a problem. Anyway, we have only a few minutes left. Okay, Pratham, a quick advice for our viewers.
Akram, fall is a quite serious thing. One should know that, and especially in the elderly population, it can lead to serious consequences. So you need to recognize it and know how to prevent it. And then, even if this happened, there are ways which can be treated, and the key thing is that you have a risk assessment from the social services and make sure that it does not happen again.
That's amazing. Thank you, Pratham, from Dublin. And of course, Mo, what would you say? What is the main message for these people?
Well, as Pratham had said, we have to prevent the falls. Be aware of that, because it's one of the common things. Simple things. We look at the house. You look at your house. Make sure ways and the alleys, the corridors are free. Carpets are well fit, not bended, that it might cause the fall. One of the things I would say, please speak with your GP or your local health authority if you want any personal hazard assessment at home. They will help you with that, and that's the most important thing. The most other important thing, please, if you are on a lot of medications, don't forget, have an yearly check-up with your GP once or twice a year. Make sure everything is okay, your doses are normal, it's not going to cause you any harm in the future.
Thank you very much. That's amazing. It's more from it's a consultant who works in Essex, Mohamed, Ahmed, and Pratham Surya, who joined from Dublin, and he works in Midlands as well. Well, it's quite small show, but we have somehow covered everything what we need. So today we talked about fall and hip fractures. This is very common, especially when we're living with lots of elderly people, our parents, our grandparents, or our neighbors. So this is an important show. Go back and watch a little bit more carefully. And lots of things in the NHS website you could learn as well. And by the way, next week we're talking about tonsils and grommets. This happens. This is an ENT condition. Especially young children, they have this one. And on 24/12 we have a really special program for all of those children who are going to school, like who wants to be doctors, and parents who want to make them doctors. This is the program is called How to Get into Medical College in UK. This is really important program, so you guys keep an eye and don't miss it. And anyway, today, thank you for staying with us on Iron Health Talk with Dr. Akram. If you have any further questions, please email us healthtalk@intv.co.uk or message us on our dedicated YouTube channel, Health Talk with Dr. Akram, or Facebook, Twitter, Instagram. And we will respond to you as soon as we can. But for now, goodbye and keep yourself safe. Thank you very much.